Okay, good evening. This is Paul Lynch. I'm going to wait just a second because it looks like, oh yeah, I think everyone's on now. Okay, this is Paul Lynch from Arizona Pain. And I appreciate many of you that were able to join us tonight. For those of you that don't know, you probably haven't seen me around the clinic the last week or so. I'm in New York City. I'm in a hotel room here at night. I'm working in the intensive care unit at Bellevue Hospital for the next couple of weeks. I trained at Bellevue. I did anesthesiology training at NYU in New York City. And Bellevue Hospital, for those that don't know, is kind of like the Statue of Liberty of healthcare. Give me your tired, give me your poor, give me anyone with any insurance or no insurance or bad insurance. So we take care of the sickest of the sick in New York City. We're a level 1 trauma center. And I was lucky enough to train here 18 years ago. And as this crisis was playing out, many of my friends and mentors, anesthesiologists, began getting sick. And I heard the messages that they were getting overrun and they didn't have enough staff in the hospital. And so, so I made the decision to come back and help. And so my trip was planned for like 18 days. And what I've told people is, I'll be here as long as they need me, for as little as they need me. If things start calming down next week, I want to come home and see my family again and see you guys. But if they need me longer, I'll stay longer. Right now, it feels like being in a war every day with hundreds of patients intubated and in the intensive care units and dying. And some of them are so sick that we have to put them on what's called ECMO, where we take their blood outside their body to put oxygen in it and then put it back in because their lungs just aren't functioning. A lot of people have asked me over the last week or so, what in the world are you doing in New York in the middle of this? Don't you have 5 kids at home and a family? And I just wanted to address it a little. When I was here the first time, even before my anesthesia residency started, my wife was going to NYU dental school, and I spent most of my 4th year medical school in New York. And I was living in Queens. I actually moved to New York City on September 2nd, 2001. And what a wonderful first week we had. It was beautiful fall in New York, and we went into the city and we went to plays, and we thought it was the most incredible place ever. And then on the morning of September 11th, 9 days later after I moved to New York, the terrible tragedy happened with the towers. And I didn't know what to do. I was a 4th year medical student, and I just jumped on a subway and I rushed into the city, and I tried to get as close to the towers as I could. And I saw on the news that most of the patients were going to St. Vincent's Hospital. So I went straight to St. Vincent's Hospital, and I even put my white coat on as a student so they would think I was legit. And I showed up and I said, what can I do? I'm here to help. And they basically, they told me to go home. They said there's no patients. Everyone was dead. There was nothing that they could do. And that's not completely true. There were some patients, I know, because they went to Bellevue, and I heard the stories later, but it was such a helpless feeling to see the tragedy, to see the death and the dying, and not to be able to do anything. And so when this happened, I was sitting at home with my family, and I felt God was telling me to come and help. And I have to tell you, I didn't feel helpless this time. I knew that I had the training. I knew I had the skills that could make a difference in some of these patients' lives. Some of the very mentors that were training me were sick and couldn't even come to work. And I knew how they thought, and I knew what they did. For those of you that don't know, anesthesiologists do 3 things really well. One is we put people to sleep, and that's pretty well publicized for surgeries. 2, we do pain management, and that's what I've chosen to do in my career. But 3, we're really good at taking care of people at the end of life in intensive care units. And so whether it's managing their heart or their lungs or their kidneys or intubating people or quickly and rapidly changing blood pressures, like that's what we're good at. And so when I saw that the intensive care unit was being overrun, I had to come. The second question I've got is, well, what about your children, Dr. Lynch? You have 5 kids and they need you too, and they depend on you. And that's so true, but I have to tell you guys, I'm trying to raise kids that will run into a fire if there's someone that's in need that will respond to an emergency. And the only way I can do that is to live by example. Before I left, I said, you know, the world has somehow concocted a crazy movie where anesthesiologists are needed, and there's no way I can, you know, sit on the sidelines when I know I have that skill that can make a difference, and sit at home. And so I am thinking about my kids by coming here. I hope that they grow up and would do the same exact thing. So let me tell you a little bit about what's going on the ground floor. I just want to tell you a little bit about what it's like. So in the intensive care unit, I used to work here, we would have 12 patients in a day. And we would split up the list into maybe 3 or 4 patients each, because we always have teams. And maybe one patient on our list was really sick. And so most of your day, literally most of your day, would be thinking about that one patient and how to keep them alive and the different maneuvers we could do. Well, today, it's most of the hospital is intensively ill. We've brought in anesthesiologists and intensive care doctors from all around the country, from the military. The military showed up with 200 volunteers. I guess not volunteers, they were forced to go by the military, but 200 physicians and nurses that came in. They didn't all come to Bellevue, but many of them did. We've taken the ORs and taken one operating room and made 4 beds for patients. We've taken the most critically ill patients and put them in our classic ICUs and put 2 patients to a room and sometimes 2 patients to a vent. Where normally we're used to having 1 or 2 patients that we're really worried about, it's everyone on our service at this point is critically ill, and not just critically ill, but we don't expect many of them to survive. And that's what's been so scary about this is when we intubate them, we're finding that maybe 70 or 75% will never wake up. And so it is a really hard situation. But in the midst of it, I just want you guys to know that I've learned a lot, and it's hard for me to make these videos and talk about this stuff because it's emotional. But I want you guys to know that I've learned a lot too, and I want to teach you guys some of that. I think one is when Dr. McJunkin and me started Arizona Pain, almost 13 years ago now, we said we were going to start Arizona Pain with the idea that we would treat every patient like our own mom or dad. And that's hard to do. But what we teach the other doctors and nurse practitioners and PAs and residents and fellows and all the people that have rotated through with us is if you have a difficult decision to make, think about what you would want for your own family member. But I have to tell you, when I was an anesthesiologist working in the ICUs before, I worked in New York City for 4 hard years. I did a year's surgery in Manhattan and then 3 years at Bellevue. I don't think I treated every patient like my own mom or dad. As a matter of fact, if I did, I don't think I emotionally would have survived the 4 years, because we saw so much death and dying and trauma, and every night was difficult. And I think it was too much for me to think about each family or each person like my own mom or dad. I think I just did my job, and I tried to stay disconnected so that I could make it through another day. But this time when I've come back, maybe I'm older or wiser or closer to God or whatever, but every patient that I see, I try to think about, if that was my family member, you know, what would I want? And it makes it hard. Sorry. It makes it hard thinking about someone that's your family member that's dying. And so it is a very difficult thing to do, particularly when you're going to a code. But I want to tell you about a couple of patients and how I think I'm helping them. One is, the first couple of days I was here, I wasn't working in the ICU full-time all day. I was actually on a team with the anesthesiologist. And so I was on the airway team for a couple of days in a row. And I would go to patients that were on the floors, not in the intensive care unit yet. They were still awake, they were still talking, but they were heading down really, really quickly. And so I would get there, and I thought about, through the concept of the mom or dad tests, like, what would I want if my mom or dad was in that situation? And I read an article on the way out here that said that about 70% of people that get intubated, you know, won't wake up. And I thought about me going to their airway, to the code, as we call it, is almost like a funeral. And it's the last time they're going to talk to anyone. And I got to the room of one individual in particular, and he was so scared. and he was gasping for breath and breathing probably 40 or 50 times a second. And he was scared. And I just thought about this might be his last, time where he's really having a conversation. And so I wanted to know about him, and I asked him questions. Where are you from? And he told me, and I can't say too many details because of HIPAA, but he told me where he was from. And he was an immigrant from another country, and he came here and he really made something of himself. He had a wonderful job. He was actually working in surgery, and he had multiple kids. And I asked him about his family, and I asked him about his experiences, and he got to grow up in New York City. And then I realized he liked the Yankees, and he went from being really scared to smiling. I'm sorry, it's really hard to talk about some of this, but he went from really scared to smiling, and we started talking about the World Series championships and some of the championships we won. And we talked about Jeter. And when he got to Jeter, he really just perked up and he smiled and he told me about that. And we ended up intubating him and taking him to the ICU. And it made me really happy to know that if that's his last conversation, he enjoyed talking about his family and his job and baseball. I'm sorry, it's really hard. So I've gone back by and seen him every day since then. That was 5 days ago, and he's still alive. And I'm praying that we're going to keep him that way. And if you're the praying type, I pray that you will pray for him and that we'll get him through this. So I was going to tell you another story about a patient, but I don't think emotionally I can right now. So I'm going to move on to a teaching point for you guys. So one of the teaching points that I really want you guys to hear is the importance of personal protective equipment and just protecting yourself, whether you're a doctor or working in our clinics, if you're one of our staff tuning in, or just a patient. A lot of the stuff that we have to do in the midst of this epidemic. And right now, by the way, the numbers are looking better in Arizona for the first time. I mean, it looks like we're flattening the curve, but I want us to stay vigilant. It is possible it could return in the fall, or, and so there's a lot that we can learn. And the biggest thing that I think I learned this week for me personally is protecting myself. So I wash my hands about 50 times a day, like legitimately, maybe 100 times a day. If I touch anything, I wash my hands. I walk around with Purell in my pocket, and they're on the walls in the hospital. I wash my phone 10 or 15 times a day, because if I touch something, wash my hands, and then touch my scrubs and then touch my phone, then my phone is infected. And so I'm trying not to play on my phone too much or talk on the phone. And if I touch it, I try to wash it. So I'm washing it 10 or 15 times a day, and that's okay. Most of our phones are really waterproof now. I'm wearing booties, and I'm wearing a hat, and I'm wearing an N95 mask, and I'm wearing a face shield. And there's a right way and a wrong way to take off the mask. You should never touch the front. I laugh when I say that because I was doing a video last week to kind of teach on this, and I grabbed my mask and everyone called me out on it, but I think I was tired at the end of the day. But the way you take off your mask, the way you take off your gloves, when we go into the room with the patient, we put on a gown and a hat and mask and double gloves, and then there's a certain way we take it off. And so just being incredibly careful about not transmitting the virus to other people or to yourself. When I get home and I'm staying in a hotel by myself here, there's no one to infect, but I still don't even want to bring the virus into the room. Studies have shown that 50% of healthcare workers in China, when they were working in the hospital when it first broke out, 50% of them had the virus on the soles of their shoes. So when I get home, I leave the shoes right at the door, and you could also disinfect them, which would help. I take off everything from work and leave it right at the door, whether it's my name badge or clothes or whatever. And then actually before I leave the hospital, I take off anything that I was wearing and I put on clean clothes. And then when I come home, I put those clean clothes at the door, and then I shower. I do everything I can not to bring anything into this hotel room. If I was at home with my family, I would be even more kind of OCD about it. But I think the first teaching point for you guys is just the importance of the way we clean and wash our hands and do stuff is totally different than anything I've ever done before. And then the second teaching point that I want to give you guys is being on the front lines. You know, you see stuff in social media on the news and people arguing all the time about, is this like the flu or not like the flu? I'll just tell you, it's 100% nothing like the flu. The craziest thing about this disease is it hits your lungs first, and that's why we intubate them on the floor sometime to help them breathe. But then as the disease progresses, what happens is it's called a cytokine storm syndrome. And that's a big word, but it basically means all these inflammatory things are released in your body. If you have chronic pain, you probably understand what I'm talking about with inflammatory markers and inflammation, but all these cytokines are released and CRP and SED rates go up and D-dimers, which means it's breaking down your blood, and ferritin goes up and lactate goes up, and all this stuff happens in your body, and then your organs start shutting down. And so, and I'm not telling any of you guys this to scare you, but just so you understand what's going on the front lines, people start having heart failure and then kidney failure. And so the teaching point from it is, I think all of us should be as healthy as we possibly can be during this virus. I can tell you, for me, I started reading about this virus and really figuring out what was going on in the first week of March. And in that time, in 6 weeks, I've probably lost 20 pounds because I mean, first, there's a lot of stress here, but I think I want to be in the best shape of my life in order, if I do get this virus, that I'll be healthy. It's pretty clear that if you have underlying diabetes or hypertension or obesity, that those are pretty bad factors for the virus, or kidney problems as well. And so I would encourage all of you guys, with my second point, is start eating the most healthy you've ever eaten. Try to get as close as you can to your ideal body weight. Exercise. We actually may have flattened the curve this spring, but it might come back in the fall. And so let's use this summer as a time to really get in good shape and be in the best health we ever have been, because it could save your life. Speaking of saving lives, I want to talk about what we've done at Arizona Pain in the midst of all this. I'm really proud of the staff because I think we've done some really smart stuff. Very early on, before everyone else was doing it, we pretty much went to 100% telehealth. We are available if you need to see us, but we're trying to see you over the phone. We're going to be working on a lot of things the next couple of weeks, including trying to do home exercises at your house so that you're staying, healthy and not having pain. There's a lot of things you can do at home. When I hurt my elbow a couple years ago, I guess 2 years ago now, I had surgery. I did a lot of home exercises, not leading up to it, which was a mistake, but afterwards I learned that I had to kind of rehab myself. So I did a lot of stuff at home. And so we're going to be working on that. We're going to be really doing more behavioral health, because I think there's a lot of stress and anxiety during this time. And so whether it's visits with your doc or home exercises or even behavioral health, I think we're doing some really good stuff. The other thing I wanted to tell you that we're doing at Arizona Pain, which I think is pretty cool, and Dr. McJunkin really took the lead on this. We started what was called the Arizona Pain Foundation 12 years ago, and we gave 5% of all of our profits to the foundation. And mostly we've supported causes around the world and some here in Arizona. But Dr. McJunkin really wanted to have a food pantry for our patients and even some of our employees that got furloughed in the middle of all this, that if they were having problems eating or paying their bills or whatever, that we would have stuff. So we made a donation from the Arizona Pain Foundation, and Tori set up this food pantry that I want to show you some of the photos. So it's completely stocked refrigerator with meats and vegetables and breads. And if there's anyone on the call right now that's not getting enough food or is hungry, please contact us and we'll make sure that you have food. And it makes me really proud. I'm here working and trying to keep people alive, but our people back home are doing everything they can for you guys there. And I'm excited to come back and be part of that soon. So I want to talk, before I finish, just about a couple happy stories. I had a really hard time earlier telling you about all the sadness going on. But I want to tell you how much joy and happiness and wonder is going on in the hospital too. from the military guys that are coming in and having smiles on their face as they walk around all day long helping, to nurses that are coming in. I met a nurse from Duke University yesterday and another nurse from Portland, to a doctor anesthesiologist that came in to help from Seattle. I really feel like we're seeing the best of people's personalities. I think the happiest moment for me so far on this trip was when I got to do what I call the best epidural of my life. And you say, well, Dr. Lynch, you've done a lot of epidurals. And that's true. I've done thousands and thousands of epidurals. But just yesterday, I did what I'll call the best epidural of my life. And the reason I say it's the best is this is an epidural that literally might save on someone's life. And I want to tell you why. This lady had a major trauma and she came into the hospital, but she also was really sick and had COVID. And so they did surgery and she had 16 fractures in her ribs. And so she hurt so bad, and she was awake in the ICU, but she had COVID. So COVID was hitting her lungs and making them work maybe at 15% of the capacity of normal lungs. But on top of having 15% capacity, she also had all these fractured ribs. And they said she was going to die if she couldn't breathe better. And they couldn't overventilate her because of her fractures. And so they wanted her to breathe on her own. And so they called and they said, well, we have a pain doc here volunteering in the ICU. And so literally like 7 different people on the same morning came and said, are you the pain doc? Would you mind helping with our patient that has 16 fractures? And so keep in mind, in pain management, we always do it in a nice sterile setting with no COVID around. And we have x-ray guidance, and these procedures are fairly easy for us. This was going to be in a COVID-19, 100% of patients had COVID. She was in a room with 2 patients. It was a small room. It wasn't very well lit. We had no x-ray guidance. And I got one of my mentors to come help me, and we positioned her and was able to place the epidural. And what we did is we threaded a catheter in and then started an infusion of medications. And when we were done, she was able to breathe more. And I looked at my mentor and we wanted to give each other 5, but we couldn't because we can't touch each other. And we literally just had this moment like, we can save that lady's life with something as simple as an epidural. And so that really, it made my day to think that this skill set that God gave me to be able to do something as simple as an epidural could save someone's life. And so if you think of it, please pray for that lady as well, because I think she has a very good chance of surviving this if she can continue to breathe well the next few days.